So what are some of your recommendations for those people who might have grade 3 and up? Is there anything they should be concerned with? And how do you live with a grade 3 outside of adding medication?
I don't know about concerned with. I talk to my clients about having an echo done on there if they're willing. Go to a cardiology place and get an echo done, because then they can tell us what the pressures are, what are the valves doing, what is this doing, what's the muscle, and then the cardiologist gives recommendations based on daily drugs. So if we can get that done every 6 to 12 months, depending on the dog, it kind of helps us.
Get perspective on how to treat the dog, keep it alive.
Because they'll even...
Question I had was, somebody reached out to me and asked me about heart murmurs, man. What's the scariest thing about a level 3 heart murmur and a dog needing a surgery?
The hardest part, you don't know how drugs are going to interact with the heart. When we anesthetize them, we change how the body functions. So with heart murmurs, I try really, really hard not to give them fluids, because you're going to fluid overload the heart and then the heart struggles. But there's certain things, let's say an alpha 2, which is some of the sedation meds, really mess with the heart, and that could stop it. So we have to be very careful which drugs we select with heart disease. I did a surgery this morning on a dog that had a heart murmur.
What
Everything
level
went
was
great.
it?
A 2.
Okay. 2 and 1 though, pretty manageable. Once you get to 3 and 4, you're like...
3 can be pretty managed. I've got one I've managed for over a year.
Okay.
But when you get higher than that, it can get a little sketch with surgery. So it's just, what drugs are you giving fluids? What's your fluid rate? Because you have to back fluids way back if you are going to use it.
Now, I'm asking too, because the guy I used to know, he said that a doctor wouldn't perform a surgery, and I think his dog had a pyometria, on a grade 3 something heart murmur. Why wouldn't a vet attempt to, we'll just say, even he was like, okay, fix her. He was like, we put her down, she's probably going to go. But it sounds like you have...
I'm scared about lawsuits. I mean, scared.
So does each...
When it's a very valid concern.
Yeah.
But if you have a client sign, like, hey, here's the extra risk, sign this piece of paper for me, because you can't come after me if something does happen, then go with it.
So once you get to 3, 4, and 5 per se, though, the probability of the dog's life goes down. Quality of life
increase.
And then if you do anything anesthetically or, anesthesia-wise, my bad, you go, okay, we're going to run into this hiccup where the heart could literally give out.
Yeah, because we got to think about it. The heart is where all the oxygen, or the heart and lungs, where all the oxygen exchange is happening. So if the heart can't pump all the good stuff out, and we alter that, we can have slow recoveries, we can have anesthetic deaths, just poor outcomes.
So what are some of your recommendations for those people who might have grade 3 and up? Is there anything they should be concerned with? And how do you live with a grade 3 outside of adding medication?
I don't know about concerned with. I talk to my clients about having an echo done on there if they're willing. Go to a cardiology place and get an echo done, because then they can tell us what the pressures are, what are the valves doing, what is this doing, what's the muscle, and then the cardiologist gives recommendations based on daily drugs. So if we can get that done every 6 to 12 months, depending on the dog, it kind of helps us.
Get perspective on how to treat the dog, keep it alive.
Because they'll even, like a good cardiologist, be like, hey, do not use this drug, do not use this, do not use this. Use these.
In case of emergency. Well, another thing, is there anything people can do to prevent heart murmurs outside of breed good dogs? But
no, most of it's age-related, just degeneration.
Interesting. When you say age-related, what do you mean?
Just older dogs getting it, and it's usually the mitral valve. It's just degenerating, just age changes.
What about a puppy? And do you know how long does it take the heart to fully develop from like birth to like what? At what age is a heart grown? I don't even know if I've ever asked that.
Grown, I don't know, but on a puppy, usually by their 4 to 6 month window, if they have a murmur, it's real. If they had one and it's gone, it's an innocent murmur and they outgrew it, because there are certain things when they're in the womb that there's different shunts that are there for the blood because the heart isn't doing what we want it to outside of the body. So they have different shunts to get things where it needs to go. So if, let's say we have an 8-week-old puppy with a murmur that's gone at 12 weeks, one of those shunts is gone, like it should be.
Interesting.
So most of the time they're gone within the first couple of weeks, if not first couple of days. So long gone before we ever see them.
It's interesting. And I've gotten videos, people of dogs walking slow, or someone's like, my dog's only got 5 minutes before his body shuts down, and that's due to clearly the heart being an influx of fluid / blood getting there, and the body's saying we need oxygen, so the dog's body says we gotta like move slow or just not move at all in a sense.
It's like I had one recently that walked real slow, like it was painful somewhere. We ended up shooting x-rays and the heart was big on the x-ray. Stuck an ultrasound probe on it and the pericardial sac was full of blood.
Oh shit.
Drained it to prove, and then has a heart-based tumor.
Oh wow.
So it was walking slow, like the oxygen exchange, it's weak because blood isn't getting to where it needs to go. I mean, it's just slowly dying.
Literally.
For lack of better words.
Literally. Good Lord, dude. That's, it's never a dull day when you're asking questions that you're getting information to that you almost wish you didn't know. Heart murmurs are a thing in the American Bully. And definitely in anything less than American Bully, when you start getting to your exotics, common in the French Bulldogs. And in some cases, Frenchies can breathe so loud that doctors can't always hear if it is a murmur or not. And then some people learn later, as you said, that the murmur comes out and reveals itself, and you go, fuck, well, what do we do now? Just the best you can. Any recommendations for those people, that are dealing with a dog that's got a between 3 and 5 murmur?
I think it's just maintaining, it's a lot of communication between you as the owner, veterinarian who's got all the knowledge. Just, hey, are we giving all the right things? Just probably don't take them for those mile-long
yeah,
runs. Like exercise restrictions important because they can just give out. It's like on some of mine, I have warned people, hey, we can run across the yard and drop dead, and then it happens. And it's like, but at the end of the day, do you want to stop the dog from being a dog? What's the balance?
Well, that's the scary part though, because when you, like you said, hey, this dog died in my backyard. We weren't hiking. We weren't up a mountain. We weren't in the park somewhere. We weren't 2 miles away from the crib. He just was jogging down the block per se, or in the backyard, hitting the fence every now and then, and split. You say, well, where'd my dog die from? I'm telling you, I don't know, but I know bad hearts are a thing. And even in Kansas City, where I'm from, a guy named David Miller had started something because for whatever reason, a couple kids had start having heart problems at a very young age, and so he implemented echo scans. My bad, that's what you call it.
Yeah, echocardiogram.
He implemented those at quite a few of the schools, kind of especially when the concussion things start going. He said, well, if we're doing that, we should check their hearts too, since these kids are dropping dead, and let's get some data over 4 years while they're in high school to ensure that heart stays healthy, or at least we have the information to know what that line is for them,
Yeah.
Which is like, damn, that translates to dogs too.
Yeah.
So that's another test that you would recommend people get, especially, I would say, if you got a working dog, and even just a dog you love, you might take an extra step and go to a cardiologist just to make sure, in general, if your doctor doesn't have the tools to get the heart, just make sure it's good. At least at what age should you start doing the heart exams per se?
I don't do them routinely. It's just one of those, when I hear a murmur, I recommend them. But a lot of people breeding on the OFA things, they'll go to a cardiologist to have an echo done for their OFA standards.
Okay.
So you do the hips. You try to get as good of a hip as possible, but you can still you have 2 excellent parents and you can still have a hip dysplasia puppy. Like,
Literally.
you just minimize all your risks of poor outcomes.
And then the heart thing's in too. Well, guys, listen, heart murmurs a thing. I'm going to reply to a few messages sometime in the next 48 hours. I saw him. I said, man, I might as well talk to the boss man about it, see what he has to say. We learned something about everything, and even the heart thing has got me more curious now, because oxygen's everything. It's how your nutrients are transported. Your blood's got to flow. Oxygen. When you see somebody on film or wherever you felt like you were suffocating, what was stopping everything? Your heart, your lungs, everything's about 3 seconds away from shutting down, and you go, man, what a terrible way to die, drowning. That's suffocation at its finest. Hope I never have to live through that one. But stay tuned, people. Take care of your dogs. Thanks always for watching.